week on the soapbox, I thought we would continue our conversation on the knee. If you're getting any knee pain at all, 9 times out of 10, it's because the tissue on the outside, so that IT band, our glute med, even the muscles along the side of the shin are probably pretty tight. So if you're starting to get any knee pain or you've had knee pain for a while, I always say you should get started on some of that release work on the lateral line of the leg. So I'm going to show you my top 3 go-to homework assignments that if any patient comes to see me, they're usually getting 1 out of these 3 techniques to try to release those muscles on their own. So the first one is a foam roller technique. The second one will be a fascial or a lateral mobilizer. And the third option is how to cup actually along the IT band and the peroneals. So without further ado, I'll show you my top 3 go-tos to release the side of the leg. So one of the ways we can release the outside of the leg is by foam rolling the IT band. So Ms. Zay's going to walk all the way out, all the way back. And I'm making sure she's staying right on the side of her leg. And again, all the way out and all the way back. And I would even cue her to go a tad bit lower on the knee as she goes out, just because the IT band does attach beyond that knee. She would do 30 repetitions every day of this. Yay. And then she's going to show us how she would roll out the quads or the front of her legs, something that also commonly gets tight with knee injuries. And she's going to walk out all the way to just at the top of her knees and then all the way back. And again. And back. And again, my magic number is 30. Okay, so what Ms. Zay is going to do now is what's called a lateral mobilizer. And what it does is it not only loosens up that IT band that constantly gets tight if we have knee pain, but it also is going to loosen up her hip and her entire right side, including her arm, because that fascia is continuous and it even goes all the way down to the side of the shin to her foot. So she's going to reach, side bend over, sending her hips in the opposite direction of her reach and come back up. And she's going to do a couple more here for us. I'm making sure that her hips are staying square. She has more weight on the front leg, and that back leg is just crossed in behind, but as you can see, she's making this big, deep C curve with the entire right side of her body. She would do about 20 of these. Then she's going to turn, set herself up on the other side, crossing the leg in behind, keeping it straight. More weight is on her front leg, and she's going to reach, big side bend over and come up. And even deeper, she's going to reach, send that hip in the opposite direction and come up. So another great tool that I find the kids can do at home is using what we call the cups. So there's ones you can get off Amazon. These ones are just kind of a do-it-yourselfer. It's not the glass ones that you'll see in acupuncture a lot, where they like light a match and almost use the fire to create the suction. These are like create your own suction. So they're pretty foolproof. And I'm just going to use kind of any type of massage cream. You could even use just regular lotion. And I'm just going to kind of lather up. Again, focusing on the side, this whole lateral line, and also the front of the quad. And notice I'm going past the knee, because again, that IT band comes down and attaches to the top part of the shin. So once she's all lathered up, I could go on to massage, but if you want to save time, and again, the kids are trying to do this on their own, we'd use the cups. So all you do is you would push into the center, and then I just kind of peel it on and let it go. And you'll see it's created a bit of suction. Again, you can get ones where they're like a firmer plastic and they come with a little gun, and so you can control how much suction it has. These ones, again, just another version, so you kind of get used to how much push that you need. And then I would do it, maybe one on the top of her IT band. Again, you can use 1, 2, maybe even 3, again, focusing on this lateral line, especially where that IT band attaches, even down along the shin here. With knee injuries, it's all connected. So what I would also work on as a physio is I would also work on releasing her upper glute or her glute medius, because that also is tight if we find tightness along this lateral line. Leave them on for max 3 to 5 minutes. This does not have to cause pain to be effective. So if she was like squirming and giving me like weird faces, I would ease off a bit. So you can take it off, maybe just lighten the amount of pressure that I put on, or maybe just do the one. Again, we're trying to be gentle. Fascia release is the best. When you're gentle with it, it's not the intent to cause pain, but what it does is it tractions any of the tight tissues and just kind of separates the layers. It's another way of releasing that fascia and muscle.